This lecture is going to be on causes of hyperfibrinogenemia, or increased concentrations of fibrinogen in blood. Fibrinogen is found in plasma as the soluble precursor for fibrin. When fibrinogen is cleaved to form fibrin, then the fibrin strands bind to each other and to platelets to form an insoluble clot, and that's what's pictured here. There are two causes of hyperfibrinogenemia, and they are inflammation and dehydration. Fibrinogen increases in times of inflammation because it is a positive acute phase protein, or APP. And this just means that its production is increased during times of inflammation. To determine if hyperfibrinogenemia is caused by dehydration or inflammation, you can use the plasma protein to fibrinogen ratio. When a patient is dehydrated, the water component of plasma is decreased, resulting in proportionate and relative increases in plasma protein and fibrinogen concentrations. As a result, the plasma protein to fibrinogen ratio is normal. However, during times of inflammation, fibrinogen production is increased without an increase in non-fibrinogen proteins, and this results in a decreased plasma protein to fibrinogen ratio. In cattle, this is less than 10, and in horses, this is less than 15. However, if the ratio falls within a gray zone, then we don't know if the hyperfibrinogenemia is due to dehydration or inflammation. Since the plasma protein to fibrinogen ratio is used to determine the cause of the hyperfibrinogenemia, you shouldn't use this ratio if hyperfibrinogenemia is not present. Fibrinogen is most useful in identifying inflammation when there are no other hematologic indicators of inflammation. So in this example, the leukogram and the leukocyte morphologies are normal, and those do not indicate inflammation, so there's no left shift, no toxicity. However, the fibrinogen concentration is increased, so we'll perform the plasma protein to fibrinogen ratio. In this case, the plasma protein to fibrinogen ratio is 8.7 divided by 1.1, which equals 7.9. So note that I did change the units of the fibrinogen so that it was the same as the units of the protein. So since 7.9 is less than 10 in a ruminant, we have identified inflammation even though there were no other indicators of it in the CBC.